Hello and welcome to your Enhanced Clinical Practice CPD certificate. So the aim of this certificate is to run in parallel with your apprenticeship standard. And that's because you're working within a health and social care setting as a registered practitioner. So either a nurse or a CQC registered manager, and you want to have a better knowledge skill set around physical health needs. Now, the aim of this is to give you a better understanding of how to collect history, how to conduct neck, skin, ears, eyes, nose, and throat examinations, look at respiratory examinations, cardiovascular examinations, abdominal, neurological, musculoskeletal, and then looking at some blood results. So at the end of this, you'll be making what's known as more like a nursing diagnosis than a formal medical diagnosis. It's to support your clinical decisioning or clinical decision reasoning skills, I should say. Um, it comes directly out of the advanced clinical practice standards. So this is, in essence, a level 7 kind of modular work, but we're doing it at level 6. And that's because obviously you're not going to be formally diagnosing. It's to help with that diagnosing process, clinical judgment and reasoning. So with that in mind, I'll explain how it works. So you'll log on and at the start you'll have your course summary. So you'll just read the course summary, you'll go through that and you'll hit next. It looks at the multi-professional framework for advanced clinical practice. So once you've done your apprenticeship and your ECP, and you may want to go on to advanced clinical practice, so the ECP is the one below this, it just looks at NHS England's created a new framework for advanced clinical practice. So looking at our introduction, around our clinical reasoning, obviously we want you to have a basic anatomy and physiology understanding already. If you haven't got that, there's a great website in YouTube that you can go to really help formulate your anatomy and physiology skills. Your physical assessment techniques already should be there around vital signs. You're going to learn 3 new techniques, which you may have already learned if you're a healthcare nurse, but if you're a mental health nurse, this will definitely be new to you, which is about palpation, percussion, and oscillation. And again, we'll talk about that when we go into the modules. Um, you need to understand the difference between normal and abnormal findings. So no different really when you did your vital signs training. And again, this will help formulate your clinical reasoning. So what did you want to have or where you want to go? So if we think about once we've done this, we're looking at SABAR, so reporting things on, so the situation background assessment and recommendations, and then we'll look at some of that documentation. So the modules are designed that you run through them by yourself, you complete the assessments at the end, and you upload them. The skills by the end of this, obviously we want you to have a really good systematic history taking skill set. And there's lots of acronyms out there. You might see Socrates or others. But again, how you do that is entirely up to you. If you want to go into Amazon, there are some cheat sheet cards that you can buy and download that helps you through taking a systematic history taking, but you will cover this in the modules as well. You'll look at a range of assessment tools for your findings, look at those frameworks for clinical reasoning, and look at those diagnosing the patients. So the scientific knowledge that you need to obviously have here is a foundation of relevant anatomy and physiology. So again, if that's not your subject matter, do go in and update yourself, and especially around the systems in which you're looking at. So again, musculoskeletal, so your skeleton structure, your muscle structure, and then you'll be looking at nerves, because again, you do a nerve assessment, the head, the heart, the respiratory, your cardiac, respiratory, and abdominal. So again, just a bit more understanding around those key organs in which you're going to be doing the assessments and examinations on. So if we look at session one, which is looking at systematic history taken, we already have lots of ways of doing this. I'm sure you've been doing it for years. But it's an understanding the importance of going through the patient history, developing that systematic approach so you're not missing anything, and making sure that you have information on medical, social, and family history, so genetics as well, forming part of that clinical reasoning. You'll identify key communication skills. So again, looking at those note-taking skills, looking at being an empathetic communicator, and thinking about Egan's theory to communication, so love that. You'll obviously evaluate the patient's current medical history. You'll look at the risk factors there and look at outing those concerns. And then you'll apply your clinical thinking skills and analyze this to help form a plan. So when we go through this, there are OSCE guides for everything. So OSCEs are your structured clinical examinations, on observation of a structured clinical examination. And if you go to Google Geek, there is some great guides there. And again, I've given you some links here. So you've got your Geek Medical there. And again, if we look at presenting a history guide here, you've got some wonderful resources here, looking at the tips, notes, frameworks, being open and honest. There's Socrates that I just recently mentioned, looking at all your family history, your findings, a summary. There's the example patient to work through, and normally they have an OSCE guide on there as well. So when you look at some of these, it actually gives you kind of the marking criteria of what you need to be prepared for and against there as well. But again, just looking at the systematic reviews there, so you'll run through that, and that's kind of your head to toe, and there's OSCE guides for all of those as well as you go through.
Do you have a
So
child in secondary school from just
ignore some of those effects, go straight to the video, and in here I've given you links to videos which are really helpful to get your understanding around the first set of history taken. So what I want you to do is play those videos, go through them. So you've got your physical health, and then you've got your psychiatric history. So looking at a mental health history taken as well. So you've got your physical health and your mental health and well-being. And then at the end of this, you end up with your first assignment there. So if we go to student view, we'll pop that on here. So the student view then here is following the requirements to complete it. You need to obviously undertake a systematic history review. And you need to show that you've met these 5 learning outcomes. So you need to understand the importance of taking a history. You need to develop a systematic approach. So if you're going to use Socrates, use that as part of your example. You need to identify key communication skills. So again, I would expect you to talk about Egan's communication skills for Solar, sitting, open, leaning, and maybe Shannon Weaver for send receiving information. You need to evaluate the current and past history, look at any relevant risks, and then you need to think about how you're going to formulate your plan. So as you go through that, you'll complete those tasks. So I'm just going to click to the assessment because we're in student view.
How confident are you in taking a psychiatric history?
There we go. So here I've given you a quiz, and the first one is a multiple choice test. So this will really test you whether or not you've understood a systematic history taking. And when I come out to see you, I will obviously be observing you do this anyway. So a really nice, gentle break-in to understand and how to do a systematic history taking in healthcare using your Socrates, using your Egan theory to communication, and Shannon Weaver's. And then hopefully you will all pass that with no problems. Once you've completed session 1, which is undertaking the history, backgrounds, you are then going to move on to session 2, which is head, neck, skin, ears and eyes. And again, you're going to do exactly the same thing. You're going to run through those. As you complete them, you'll see that you get a little green tick, so we know that you've completed it. And just be mindful that the first one I've done as a multiple choice. This one, it is a practical one, so you are going to have to do a recording of you performing a neck, skin, ears, eyes, nose, and throat examination. And again, you'll have the videos there to watch, so you'll know how to do it. I've given you links to different things to have a look at. And again, you've got your extended reading there. And there is your examination guides for your OSCEs. So you do those and submit those there. And again, same for all of the other sessions. So once you've done those and you've worked your way through this module, you will have completed your basic enhanced clinical skills, which will then enable you to move on to your apprenticeship side. And then if we leave the student view and we go back to the apprenticeship side, which is this one, the Enhanced Clinical Practitioner. So as I've said, it works alongside this. So you can see you've got 11 months. I predict this will probably take you about 3 months to complete your clinical skills, because again, it's that advanced skill set. It's module. It's no different to doing it at university as your first module. And alongside undertaking those, you'll need to be completing some of these works here. And again, you kind of got the 2 modules open. So you've got your CPD certificate open, plus you've got your apprenticeship open at the same time for the first 3 months. And it won't be until you've completed the first module will I come out to see you, because you wouldn't have completed everything. However, I will have marked everything, so I will know that you've developed those new skills, and then we'll look at how they embed into the apprenticeship, which is this side. So remember, you've got 2 modules open at the same time for the first 3 months. You need to be working through this. So by the end of month 3, you should be up to here, and you will have completed your CPD certificate. Okay, so hopefully that makes sense. You'll be completing your CPD stuff, working on those, and you'll be working towards these standards as well. So the CPD certificate is a CPD certificate. It just says that you've learnt the new skills, and then your apprenticeship, which is this part, will look at how you then take those new skills and then use them in your current practice. Okay, so hopefully that will make sense. And then I will do some videos on this side, and you'll see how this session runs on the apprenticeship. Okay, lovely. Thanks for watching. Hopefully I've explained the CPD certificate and you've understood it. It's self-led. You just work your way through it, complete the assessments, and then when you're done and you've completed that, I will be coming out to see you in about 3 to 4 months' time, to then link that to this apprenticeship. Lovely. Take care for now.